Hi everybody, I'm Dr. David Montag. Thank you for coming. I'm an otolaryngologist at Crawford County Ear, Nose, and Throat, which is part of Meadville Medical Center. I'm going to talk about voice and how it's produced and the anatomy of the voice box today, and voice disorders, just a general overview of them and how we treat them and think about them as ear, nose, and throat doctors. This talk is a little bit different for me because I'm used to giving talks to other doctors, so this will be one of the first times that I'm not doing that. So an outline of my talk is I'm going to talk about the importance of voice, different perceptions related to voice, and that's not something that we're taught in medical school really. This is more of a psychology area and sociology area, so it was a little bit different for me to research that myself, so I learned some things myself, and some of it is kind of interesting and some of it's kind of funny. I'll talk about the anatomy of the larynx, which is the voice box, how the voice is produced, how we evaluate the voice, and then just an overview of voice disorders and how we treat them medically, surgically, or with voice therapy. So definitions: voice is just the sound that's produced by humans or other vertebrates. So animals have voice as well, and that's just the process of using your lungs and your vocal folds or your voice box. So voice is not technically speech. Speech is the process of creating specific sounds that are decodable in language, and that's a uniquely human trait. There are different things that are important in voice, and one is the words that are being conveyed and the meanings of those words, and that's your verbal communication. But you also have nonverbal communication that is picked up even if you're not actively paying attention to that. You are picking up on these things, and that's intonation, pitch, accent, hesitations in speech, emotion. And a lot of times you're making these inferences without even being aware of it about someone's age or their gender, their area of upbringing, their level of education, their emotional state, and their health, just by hearing their voice. And the importance of that, Henry Wadsworth Longfellow had a quote that said, "The human voice is the organ of the soul." Another really neat study that I saw, and whether you believe this or not, it's not 100% definite evidence of this, but we have a very strong perception of voice from a very early age, and they looked at fetuses, 60-term fetuses, and they played their mother's voice, a stranger's voice, or silence, and they paid attention to their heart rate, and their heart rates increased when they heard their own mother read a passage. On average, there was another study looking at 80 men and women. This is one of the funny studies. They were asked to rate the attractiveness of different voices, and they weren't aware that their voice was buried in this list. And on average, people rate their own voices more attractive than others. There was another study where they recorded someone saying, "I urge you to vote for me this November," and they changed the pitch lower or higher, and they asked men and women to vote for the high or low pitch versions of the voices. And men and women both preferred men and women with lower voices as their leaders based on that study. There was another, this was a funny study. They presented masculinized, so deeper pitch and higher pitched male and female voices to men and women, and they asked them to rate the attractiveness of them and how likely they would be to cheat on them. And they found that women found men with lower pitched voices more attractive, but also more likely to cheat on them. And men found the higher pitched female voices more attractive and also more likely to cheat. There was an interesting study in the Wall Street Journal in this article. There was a group called Quantified Impressions that looked at 120 executive speeches, and looking at these, they determined that the sound of a speaker's voice may matter twice as much as the content of their speech. And other studies, there have been a lot of these, that have shown listeners rating rough, weak, strained, or breathy voices as the person being weak or negative or passive or tense. And then normal voices have been rated as attributing that person to be successful, sexy, sociable, or smart. So while I was looking at these things, there's an interesting historical side note. Abraham Lincoln, he passed away about 12 years before Thomas Edison invented the phonograph, so his voice was never recorded. But you would probably have a bias or an impression of what you think his voice would sound like given his stature and being a leader and his features. So just think in your mind what you think Abraham Lincoln's voice would sound like. So there was a historian who's written a lot of books on Lincoln, and there's been descriptions of his voice and his speeches. And Harold Holzer is the historian that said Lincoln's voice actually was a little shriller and a little higher, but even though it was that way, it still carried into crowds very beautifully. And there's a quote that said, everyone that listened to him for the first 10 minutes said they couldn't believe the way he looked, the way he sounded, and his accent, but after 10 minutes, the flash of his eyes, the ease of his presentation overcame all doubts, and I was enraptured. So this historian is saying there was 10 minutes at the beginning of the speech saying, what the heck is that? And then all of a sudden, his ideas superseded whatever they had expected his voice to sound like. And for his nonverbal communication, another historian, William Herndon, said he didn't saw wood or swat bees during his speeches, meaning he didn't gesture too much. And he said he didn't roam the stage much either. He said if you could put a silver dollar between his feet at the start of a speech, it would still be there at the end. So we talked about some of the fun things. I'll talk a little bit about the science. So the anatomy of the larynx is, you can think of as the voice box. Let's see if the mouse works here. I don't think, here we go. So you have a hyoid bone, which is a bone that just, one of the only bones in the body that's sort of floating in space. It's suspended by muscles, your swallowing muscles. And then you have your thyroid cartilage down here. It's kind of shaped like a butterfly, and in men, that gives you the prominent Adam's apple. You also have the cricoid cartilage right here, which is the only complete ring in the airway. And then you have arytenoid cartilages, which are these little conical shaped ones that sit on top of the cricoid cartilage. This is looking at it from the back. This is looking at it from the front. And then you have these little cartilages sitting on top of that called corniculate cartilages. And there's even smaller ones on top of that called cuneiform cartilages. And then these are the muscles of the larynx. You can't see all of them, but connecting the thyroid cartilage to the cricoid cartilage, they have interesting names because they're all named by where they attach to, the two ends. So this muscle is called the cricothyroid muscle. And it lengthens the vocal cords to increase your pitch. And then you have the cricoarytenoid muscle. This is the lateral one, and that makes your vocal folds swing out so you can inspire. You have a posterior cricoarytenoid muscle. That's this one, actually. This is the lateral. The posterior is the only one, that swings them open when you're breathing in. The rest of them will close the vocal folds. And then this one is your thyroarytenoid muscle, and it's really what makes up your vocal fold, or your vocal cord, you can call it as well. So this is a bird's eye view. If you're having an exam by an ENT and they're looking with a scope, this is the view they'll see. This would be towards the front of you here. This is the back of your tongue. There's a little valley here called the vallecula. Here's your epiglottis that we saw in the previous slide. And these are the vocal cords, these white bands in their closed state. These red bands here are called the false vocal cords. And then you have these folds called the aryepiglottic folds that come back this way. And these are your arytenoids, and we saw those arytenoid cartilages. And that's where your vocal folds or vocal cords are pivoting in and out to go from this state to this state. So that's how it would look if you're breathing in. And then if you take a vocal cord and you cut it like a piece of bread, like a loaf, it has a lot of different layers to it. And the first layer is kind of like a skin layer. It's called the squamous epithelium. Deep to that are some gelatinous layers, and it becomes stiffer and stiffer as you go deeper. So there's 3 gelatinous layers. There's the superficial lamina propria. They call it rankease space sometimes. And then you have an intermediate lamina propria and a deep lamina propria. And you have more and more elastic fibers the deeper you go. And you have the muscle here. And this part of the muscle is called the vocalis muscle. And your vocal cord, not only does it move in and out, but this surface, it vibrates. That gelatinous layer allows it to vibrate a lot of times, and I'll show you how that works. So this is an example of the physiology of voice and how you produce sound and how you get that surface to vibrate. So right here you have air generated by your thoracic muscles and your diaphragm pushing air out from your lungs. It's coming up your windpipe here towards your vocal cords. And as that pressure comes up, the vocal cords start to open from bottom to top. You can see they're almost completely open, and then here they're completely open. And then they close from bottom to top. And the way that works is a passive process. When you have the air flowing past, it creates a negative pressure behind it, so it pulls the vocal cords back together. That's called the Bernoulli effect. And that process, that whole thing I showed you, it happens 110 times per second in men, 180 to 220 times per second in women, and about 300 times per second in children. So you can imagine it'd be really hard to see that. So we have some special techniques that we can use to actually see the mucosal wave. And this is just paragraph fashion. If you like words more than pictures, I put it on here, how the diaphragm and chest muscles, abdominal muscles, move air out of the lungs, and that pressure causes the vocal cords to open, and the low pressure behind them causes them to close. And if you have more air pressure forced past, you're going to have larger waves. It's going to make your voice louder. The pitch of your voice changes as a result of stiffening and lengthening of your vocal cords with those muscles I showed you. And your nose, your mouth, your throat are hollow cavities. They're involved in resonation of your voice. And your tongue, your lips, and your palate are all involved in articulation and forming sounds. So there's multiple ways to evaluate the voice. There's questionnaires that have been validated for reliability between different raters. And one of these, it's the own patient's perception of their voice. And a very common one is called the Voice Handicap Index 10. I'll show you an example of that on the next page. But there's other questionnaires that people use as well. Instead of using the patient's impression of their voice, you could have the doctor determine how abnormal the voice is. So we use something called GERBAS, which is grade, and that's whether it's mild, moderate, or severe problem. And then you rate the roughness, the breathiness, asthenia, which is weakness, and strain. There's other ways to actually look at the vocal cords. In that view I showed you, the bird's eye view, you can see that with something called laryngoscopy. I'll show you a video of that and tell you what you can see with that. You can do stroboscopy, and that's the special technique where you can see those really fast mucosal waves. And I'll show you a video of that as well. And the last thing I'm not going to talk about very much, acoustic analysis. It's very specialized and mainly just used in research right now. So this is a sample of the Voice Handicap Index 10 that patients rate themselves. It's 10 items, 0 to 4. And you can just see for yourself there. And the higher the score, the worse the voice problem is. The lower score, the better. It's nice to use this as a baseline for treatment. You see what the patient rates this as themselves at the beginning, and then after treatment, you have them do this again, and you can see how much it improved. And there's an actual way to score it. So none of the video is embedded properly, but I want to show you an example of flexible laryngoscopy, which we do in our office, and it's a way to look at the vocal cords and see if they have any abnormal growths, to see if they move normally. There's a rigid scope too, but we don't usually use that in the office. And this is a video on YouTube of someone doing that procedure.
Just go through your nose. And we're looking first at the inside of your nose.
So she has a fiber optic scope that's flexible.
On the other side too.
And she has a video monitor, which we do have in our office too, but a lot of times we do it just looking through the scope.
Both sides are pretty open.
You're seeing her nose,
okay?
Inside of her nose right now.
Pressure between your eyes, sorry.
And there's the back of the nose on that screen.
All right, So now we're at the back of your nose. Just breathe through your nose for me. Good.
That's where the adenoids are, if you're curious about that.
Looks pretty normal. I don't see a lot of drainage. Bear with me. Good. You're doing excellent.
You can see her tongue,
Stick
her
your tongue
epiglottis.
out for me. Stick it all the way out. Good. Put it back in.
So you can kind of see her tongue move forward when she sticks it out. And you can see the vocal cords there.
All right, so down to your vocal cords here. Take a big deep breath in.
And when she
Good.
breathes in, you can see them move out.
Do it for a little bit longer for me. Good.
And you can see them come together when she says
The whole area
"ee."
is definitely looking better. Take a big deep breath in again. Good. They do, they look better.
Okay, so that's something we can do in the office. So I'm going to be going back and forth between these. We have a few videos that we have to do that with. So on that exam, they didn't show this, but we spray a numbing medication in the nose first. It's usually not that painful. It's kind of an uncomfortable sensation, like getting water up your nose. And we go through the nose partly to look at all the structures in the nose, but you won't gag that way either. So you can see how well the vocal cords move. You can see if there's any growths on them. You can see if when you're speaking, you're squeezing all of the structures above, like your epiglottis and your false vocal cords, and that can be indicative of a problem as well. You can see if secretions and mucus are pulling on the vocal cords or on the back of the tongue. And you can look at all these other structures, the nasal cavity, the back of the nose, the throat, base of tongue. You can evaluate all these structures at the same time. So I'll show you a video of stroboscopy. And this is a technique to look at that mucosal wave because it's moving so quickly. We use a strobe light to take still images so that we can see what's happening with the mucosal wave. It's still with a laryngoscopy, either flexible or rigid, but you have this strobe light at the same time. And there's a microphone attached to the patient that can tell what frequency their vocal folds are resonating at, and then it times the strobe light with that.
Here is a look at some normal young female vocal cords during a stroboscopic exam.
So you can see the whole mucosal wave there, what I showed you in that one image. And you can see mucus on the vocal folds, and it's normal to have a small amount of mucus there. So you get the idea. And those are normal looking vocal folds, a normal mucosal wave. And these are the things that we can see with the strobe. So you look for symmetry between the two vocal folds. You look at the mucosal wave, the amplitude of it. You look at the closure pattern, so you shouldn't see gaps between the vocal folds. They should come together. And then you look at how regular or periodicity of successive waves. And you look at the gross motion of them that you could see with laryngoscopy as well, the in and out motion called abduction and adduction. You can see if there's any growths on the vocal folds, and same thing with laryngoscopy, you can see if they're really squeezing the structures above them when they're speaking as well. Let's go back to the slideshow. So in general, there are certain things that can cause voice disorders. One would be vocal fold mobility issues. I'm talking about the movement in and out. So if they're closing too tightly or too loosely, or they're paralyzed, they're not coming together, and your voice is going to sound breathy. If they're closing too tightly and there's too much muscle tension, your voice is going to sound strained or strangulated. You can also have not enough pressure from your lungs. If you have COPD or really bad asthma, you may not generate enough pressure and your voice is going to sound really weak or breathy. There's other neurologic conditions as well where you may have weak muscles that aren't able to make tension to control the pitch of your voice. You may have tremors as well, and it can cause a tremor in your voice too. You can also have scarring of those gelatinous layers that I showed you, either from misuse or abuse of your voice, or injuries or previous surgery, and that can cause a very rough or strained voice. And sometimes with age, you lose some of that muscle bulk and you lose some of those gelatinous layers, and that can lead to inadequate vocal cord bulk, and that can cause voice problems as well. So as doctors, we always use, for any medical condition, not just the hoarseness or voice problems, we use mnemonics so that you can think of every possible problem that could be causing that. And one of the mnemonics that we use is called vitamin C. And it lets you break it down into categories. So when you're seeing the doctor, they're thinking about this, thinking about all these categories and whether you fit into any one of these. So vascular would be enlarged blood vessels on the surface there, and sometimes those can rupture and cause a hematoma in your vocal cord. Or a stroke can cause a problem with mobility of the vocal cord. That would still be considered a vascular problem. Very common problems for voice disorders are infectious, and acute laryngitis is a very common one. That's usually viral, but you can also have bacterial infections, fungal infections, and rarely tuberculosis or syphilis can cause infectious laryngitis. Trauma also is a very common cause, so you can have vocal abuse either from yelling too much, screaming, a lot of vocal demands at work, and talking a lot. You can have injuries from intubation, from surgery, where the breathing tube is put through, and that can cause some scarring there. Smoking is a very big risk of trauma to the vocal folds. It causes a lot of inflammation there. And foreign bodies as well in kids. You can have autoimmune problems that cause voice disorders, like sarcoid, rheumatoid arthritis, lupus. And this list isn't extensive. I don't have every single thing on here. There's a lot of problems that can lead to voice disorders. Metabolic problems like thyroid disease, it can cause, if you have very low thyroid, it can cause swelling in the vocal cords. Iatrogenic means the doctor did it, and that can be related to surgery or the breathing tube put down during surgery. Neoplastic means tumors, and they can either be benign tumors or they can be cancers. And then congenital is things you're born with. You can be born with a paralysis of your vocal cord or floppy cartilage structures. Hemangiomas are a benign blood vessel growth that you can be born with or get as a neonate. You can have webs between your vocal cords that are you're born with, or cysts inside the vocal cords. So I'm going to go over just the most common ones. Acute laryngitis, one of the most common, and normally it's caused by an upper respiratory infection, usually a virus, and your voice box or your larynx is usually inflamed from the coughing that you have rather than from the virus. Another common cause of acute laryngitis is vocal abuse, so shouting and loud talking. You probably noticed if you were out in a loud restaurant or a bar and you had to shout over people all night, your voice is going to hurt and it's going to be hoarse at the end of the night. Reflux or acid coming up can cause this problem too, and you don't always have heartburn with it. One of the things about acute laryngitis is that in order to have this, it had to occur with sudden onset. It's not a gradual process, and you shouldn't have any shortness of breath with it. And if you have acute laryngitis, it usually goes away on its own in 1 to 2 weeks. But if you smoke or if you have any of these other problems where you use your voice a lot, you have acid reflux, it can take longer to recover. If it persists beyond 3 weeks, that's defined as chronic laryngitis, and that's usually a reason to have that laryngoscopy done, to take a look at your vocal cords. So this is an image of someone with a normal larynx on the left side. You can see the nice white vocal cords and the pink arytenoids and other lining. On the right side, you can see that the arytenoids, those two structures in the back of the vocal cords, look very red and inflamed. The epiglottis looks red and inflamed too. That's what you see with laryngitis. And if you have really bad reflux and acid coming up, that's similar to what that can look like too. Vocal fold nodules, they're also a really common problem. It's usually related to voice abuse or misuse and frequent shouting or coughing. They're more common in singers and young children throwing their temper tantrums, and in cheerleaders and grade school teachers who have to talk over the kids and shout at them to redirect them all the time. Vocal fold nodules usually cause a raspy voice. You can have decreased range in your pitch, and you could maybe have increased bouts of laryngitis too. The way we diagnose that is by looking at the vocal cords with laryngoscopy, and you should have opposing symmetric swellings in the mid portion of the vocal folds. I'll show you a picture of that. The treatment for this actually is just limiting your voice and doing vocal hygiene, which I'll talk about later, and voice therapy, and it can take weeks to months for it to resolve. Most of the time you don't do surgery. If you have to do surgery, it's likely to come right back if you don't do these other things. So on the left I put the normal one again, and you can see it's really subtle. These two little tiny bumps, these little nodules right in the middle, they're always in the same place, they're always symmetric and always right across from each other. So that's how you can tell it's a vocal fold nodule. Vocal fold polyps is another problem. No one knows for sure what causes them, probably voice trauma, or if you had one of those enlarged blood vessels that it bled into, it could be a hematoma that was healing. And in this, you only see a growth on one of the vocal folds. Very large polyps may even cause trouble breathing. And it leads to chronic hoarseness. The treatment for this is to remove it with surgery if it's very large, but you still need to do voice therapy and these other things because it can come back as well. And if it's small, it may go away with voice therapy. Polyp on one of the on the left vocal fold there. Another problem is contact ulcers and granulomas. These usually occur on something called the vocal process. That's part of your arytenoid cartilage that extends out into your vocal cord, and that's where the vocal cord attaches. That's usually caused by voice abuse, a lot of throat clearing, or having the tube put down for surgery, or acid coming up from your stomach. And with this problem, you'll have hoarseness, but it might feel like there's a foreign body there. A lot of people have this foreign body sensation just from acid coming up, though, too. So if you have that, don't think that this is the most likely problem. The treatments for this are controlling acid reflux, vocal hygiene, which I'll talk about, and voice therapy, which I'll talk about. Interestingly, people have been using Botox to paralyze the vocal cord to allow it to heal. And that's something that can be done in cases where it's not getting better. And you only want to remove it in cases that don't respond to all of the above measures, because this has a very high chance of coming back. And it looks very impressive on this scan. This is frequently how they look. Sometimes they can look red instead of this yellowish color, but you can see it's in the back part of the vocal cord, just on the one side there. Vocal fold cysts, I don't see a lot of these. You can sometimes be born with them, and sometimes it can be from a traumatic problem or having the breathing tube put down again, usually for a long time. You can have chronic hoarseness with it. And a lot of the time, since this is under the surface, you need to have that stroboscopy to figure out if you have it, because you'll have problems in the mucosal wave, but not in the way it physically looks. And the treatment for this is surgery, but one caveat to that is that you could have hoarseness from the surgery itself, because you can get scarring in those layers that I showed you, and then it won't vibrate as well. And this is a vocal fold cyst. This is an obvious one because it's bulging out there, but you can see the surface is normal. It's just a growth underneath the surface. This problem, leukoplakia, you may have heard of. It just means white patches, and these can be pre-malignant lesions of the vocal cords. Most of the time they're caused by smoking. It could be from chronic laryngitis or the acid coming up from your stomach again. Hoarseness is the main problem with it. And you have to do a biopsy in order to diagnose whether this is just leukoplakia or if it's a cancer. The treatment for leukoplakia, if it's not a cancer, is just to stop smoking, treat acid reflux, do voice therapy, but you have to have periodic follow-up with these laryngoscopies to take a look at the vocal cords. You want to make sure it's not growing and becoming worse. And this is an example of leukoplakia. Remember the nice white vocal cords? These are red and they have the white patches all along these. Another problem is rankease edema. You don't see it a lot, and it's almost only in smokers. It's generalized swelling of that lamina propria, that gelatinous layer. And smoking is the most common cause, usually causes a very rough, low-pitched voice. So think of Marge's sisters on The Simpsons. And the treatment for that is getting rid of the underlying cause, usually smoking, and voice therapy. Sometimes you have to have surgery for that as well. And I have another video to show you. Just a little musical interlude so you can hear rankease edema.
We love to smoke till our lungs turn gray. We love to smoke 17 packs a day.
So that's what rankease edema sounds like. Let me go back to the slideshow again. I think we'll have one more video coming up. So this is what rankease edema looks like. Instead of those nice white vocal folds you can see, they look like two water balloons. We did our musical interlude. So the surgery that we do for this is called phonomicrosurgery, and the definition of that is a highly specialized surgery that improves your voice using microsurgical techniques. So you're using a microscope with a magnified view, and you see the surgeon here looking through the microscope. This is the patient here with sterile drapes. There's their chin. You use this hollow metal scope called a laryngoscope, and it gets suspended from a table. You can't really see the table, but it keeps that still in place so the surgeon can not have any motion, have everything still. And you use these very long instruments through the microscope there. It's like working in a tunnel, something really far away. So that's what the setup looks like, and I was going to show you a video of what the surgery looks like, just a very short clip of someone removing a cyst from the vocal fold. So the whole goal is to minimize damage to the surrounding structures, like the gelatinous layer I showed you, because you're going to cause more voice problems by removing the lesion if you create scar there. So this is the microscope view. This is what the surgeon is seeing. That's a cyst in the left vocal cord. So what he did, he took a knife called a sickle knife or a scissor, and he made an incision on the one side of it. And then he takes these blunt instruments and just dissects around the cyst, just staying right on it so you're not damaging any of the surrounding vocal cord. And you can see him just taking the surface layer off of it there. And the cyst is mostly dissected free. And then at the very end, he just removes that. And then you just close up the two. You don't have to do any stitches or anything. You're not removing much of that surface. It just closes up and heals up with some voice rest.
The goal of microlaryngeal surgery is
no.
to treat vocal fold pathology while preserving
Let's
voice
close that.
function.
Okay. All right, there's no more video, so we'll just go back to the presentation. So voice therapy, you saw me talk about this as a treatment for most of the voice problems. Even if you do surgery, you usually have to have voice therapy to prevent the problems from coming back. So voice therapy, it's an approach that uses vocal and physical exercises that are coupled with behavioral changes to help treat the voice problems. because a lot of these are driven by behavioral components, and you're never going to get better if you don't change those behaviors. So you want to eliminate harmful vocal behaviors, and that's called vocal hygiene. You want to help shape healthy vocal behaviors. And this technique is used, like I said, to assist in healing after surgery or an injury. You usually get 1 to 2 sessions per week for 4 to 8 weeks, but it is variable depending on how bad your problem is and what type of problem you have. And that is performed by a speech-language pathologist. So if I see any of these problems, I'll send patients to the speech-language pathologist, who we work pretty closely with to come up with a treatment plan. And that can be done here at Meadville Medical Center as well. And then finally, this is part of vocal hygiene. These are tips I give patients, handouts that I give for a healthy voice. So you want to drink plenty of water and stay well hydrated. That's 6 to 8 glasses a day. That's more than most people would think. And you want to avoid dehydrating substances like alcohol and caffeine, especially if you have voice problems. And you can see I capitalized do not smoke. That's one of the worst things you can do for your voice and the rest of your body. That includes secondhand smoke too. If you have voice problems, even secondhand smoke can cause irritation in your larynx. You don't want to abuse or misuse your voice, and you've heard me saying that, and what I mean is you don't want to habitually yell or scream or cheer. You want to avoid talking in noisy environments if you can. If your throat hurts or it feels dry or hoarse, you want to just limit how much you're speaking. Sometimes it can be hard to do, but that's your voice telling you, that's your body telling you that you need to take a break. You can use non-visual cues to attract attention. So waving someone over, don't give them the bird. And you can use amplification systems. So if you're speaking frequently, like in a classroom as a teacher, you may consider getting a microphone system or amplification system so that you don't have to project as loud. Throat clearing actually can make these problems a lot worse. You want to minimize throat clearing. It can cause more inflammation in your throat. So I tell people if they feel the need to throat clear, take a sip of water. It usually helps resolve it. And then you're also drinking more water. And you want to use your voice just moderately when you're sick because you're straining a lot more to try to project. You're working a lot harder and using the muscles in an inefficient way. So you want to minimize voice use when you're sick. And that's it. If you have any questions, I'm happy to answer them. And if you have any voice problems or you're concerned, there's our address, and happy to see you and evaluate you. Yeah?
Can you tell me about the technique flow speech? Something like flow speech? I think that's the name.
So I think that's a technique that the speech pathologists use. It's not something that I'm very familiar with. So I can't tell you exactly what they're doing, but I think it's a technique that the speech pathologists will use.
Any other questions?
Yeah.
Doctor, for people who are smokers, how often, what's the probability that would affect their voice, especially if they're a singer?
Oh, almost 100% in some way will affect their voice. Yeah, whether you're going to develop leukoplakia or anything like that, that's, I can't say for sure, but you would have decreased pitch range or some roughness to your voice. You're going to have some irritation, so it's definitely going to affect your voice in some way, even if it's just very subtly.
Thank you
All
very
right,
much.
you're welcome.